How does the detrusor muscle cause frequent urination? Imagine your bladder as a balloon that fills with urine and then empties when you're ready. The key player in this process is the detrusor muscle, a smooth muscle layer in the bladder that controls when you urinate. When your bladder fills, the detrusor muscle relaxes to allow storage. When it's time to go, the muscle contracts to push urine out through the urethra. This process is finely tuned by your nervous system, especially the parasympathetic nerves that signal the detrusor to contract and the sympathetic nerves that keep it relaxed during filling. In some cases, the detrusor muscle becomes overly sensitive or hyperactive. This means it contracts involuntarily, even when the bladder isn't full. These involuntary contractions are often called detrusor overactivity. When they happen, they cause a sudden urge to urinate and increase how often you need to go. Because the muscle contracts prematurely, the bladder can't hold as much urine as it normally would, leading to frequent trips to the bathroom. Several factors can cause the detrusor muscle to become overactive. One is myogenic changes, where the muscle itself becomes more sensitive to stimuli like certain chemicals or nerve signals. This can lead to spontaneous contractions without the normal signals from the bladder filling. Neurogenic factors also play a role. Nerve signaling can become altered, increasing the releases of growth factors or changing receptor function in the bladder lining. These changes make the bladder more sensitive and prone to overactivity. Inflammation is another contributor. Chronic bladder inflammation can cause the releases of signaling molecules such as ATP and prostaglandins. These substances stimulate the detrusor muscle and sensory nerves, heightening urgency and frequency. Additionally, changes in how the brain and spinal cord process bladder signals can lower the threshold for contraction, making you feel the need to urinate more often even when your bladder isn't full. In conditions like overactive bladder syndrome, the detrusor muscle's overactivity is a primary cause of frequent urination. This can happen for many reasons, including bladder outlet obstruction, infections, neurological conditions, or sometimes for unknown reasons. If left untreated, detrusor overactivity can damage the bladder and affect kidney health over time. While bladder cancer itself doesn't directly cause detrusor overactivity, tumors invading or irritating the bladder wall can produce symptoms like urgency and frequent urination. That's why persistent changes in urination habits should always be checked by a healthcare professional. Proper diagnosis is essential to determine whether the cause is detrusor overactivity, infection, or something more serious like cancer. Managing frequent urination caused by detrusor overactivity often involves behavioral changes, medications that relax the muscle, or therapies that modulate nerve signals. In some cases, nerve stimulation treatments may be recommended. It's important to work with a urologist to find the right approach for your specific situation and to protect your bladder health. In summary, the detrusor muscle causes frequent urination mainly through involuntary contractions that reduce bladder capacity and trigger urgency. These contractions are driven by complex interactions between muscle sensitivity, nerve signals, inflammation, and brain processing. Understanding these factors helps explain why some people experience frequent urination and highlights the importance of seeking medical advice for proper diagnosis and treatment. Always remember, individual experiences vary, and a healthcare professional can provide personalized guidance to manage symptoms effectively.